Good afternoon, everyone. Thank you for being here today. My name is Chinky and I'm joined by my groupmates Gemma, Jenna, and Mia. Together, we hope today's presentation informs and inspires meaningful discussions on improving the lives of those with Parkinson's disease. This focuses on seniors 65 and older with PD at Shina Living Retirement Home in Fountain View Community, Toronto. Due to the disease's physical and cognitive challenges, this demographic faces unique obstacles in daily tasks. The study aims to address their needs and enhance their quality of life. In long-term care facilities, approximately 4.9% have Parkinson's. Among those in private households, 79% are 65 or older, and nearly all institutional residents with Parkinson's are in this age group. Men have higher prevalence rates at 0.3% in households and 6.6% in institutions, compared to 0.2% and 4% for women. Shina Living Retirement Home supports senior citizens, especially those with PDs, through long-term care. Its circle methodology focuses on personalized experiences and quality of life, promoting happiness in daily activities. This is located south of Eglinton Avenue and west of Victoria Park Avenue, offering 158 beds in private and basic rooms. They provide 24-hour nursing and personal care services. The growing senior population is leading to an increase in Parkinson's disease diagnosis. In Ontario, over 100,000 people live with PD, primarily affecting those over 60, especially in retirement homes. Our group uses health impact assessment for future community development. We utilize focus groups and key informants as well as photo voice methods. We collected data using windshield surveys and interviews for primary data along with national surveys and health statistics for secondary data. Allow me to present Gemma, who will lead us in the discussion ahead.
The Health Impact Assessment is a crucial tool for evaluating the potential health consequences of proposed policies, ensuring that public health considerations are integrated into decision-making processes. Key components of health impact assessment includes screening, checking if a proposed action needs a health impact assessment. Scoping identifies health impact to assess the affected population while engaging stakeholders to understand their concerns. Assessment evaluates health impacts both negative and positive using statistics and community feedback. Monitoring health impacts after implementation and evaluating the recommendations' effectiveness. Reporting documents results and suggestions for easy understanding by stakeholders. Recommendations provides tips to reduce harmful health effects, helping decision-makers implement health strategies. Assessing accurate information in Health Statistics Canada provides trusted national and provincial health data, including demographics and trends. Stakeholders' input directly engage with affected communities, ensuring their needs are heard and informs the planning process with local knowledge. Can share their challenges and needs through surveys and interviews. Caregivers and staffs can share useful insights about everyday care. Looking at residents' medical records helps identify their health needs, especially related to disease progression. My groupmate Mia will now discuss about the identified challenges and strengths of our chosen community.
Residents with Parkinson's disease at Shena Living Fountain View community often face challenges in daily activities due to motor and cognitive issues. Continuous assistance from caregivers and medical staff is essential. What are the identified community's strengths and challenges? We have identified 3 common strengths. Number 1, trained staff with experience in caring for individuals with Parkinson's disease. Number 2, establish relationships with support groups like Parkinson Canada, which provide education and support. Number 3, structured routines that help create a sense of stability and predictability for residents. Here are 3 challenges to consider and address. Number 1, mobility difficulties make everyday tasks more challenging for residents. Number 2, the retirement home may lack on-site specialized therapies such as physiotherapy or speech therapy. Number 3, cognitive decline, which affects communication and decision-making. Number 4, financial or staffing limitations could reduce the ability to meet all residents' needs. Building capacity requires the active participation of individuals and communities to enhance their skills for future development. Community health nurses collaborate with those impacted by health issues and resource management organizations. They assess the community's strengths and challenges to prioritize actions. First, education and training for staff to better manage PD symptoms and provide personalized care. Second, collaborating with community healthcare professionals to enhance services available to residents. Third, improving the physical environment to make it more accessible for individuals with mobility issues. My groupmate Jenna will now discuss the organization available in the community.
Let's look at the organization already in our community. We have Shana Living Healthcare Team that includes nurses, physiotherapists, and other staff who are directly involved in the care of residents. The other one is Parkinson's Canada that provides essential resources, advocacy, and support for people with Parkinson's disease. It is vital to recognize the key players involved in our community assessment. Our gatekeepers includes facility administrators who may influence the implementation of new programs, and healthcare staff who are directly involved in the care management of Parkinson's disease residents. Now, let's identify our stakeholders. Includes residents and their families, caregiver staffs and interdisciplinary healthcare providers, Parkinson's disease support groups, and community organizations. Managing everyday activities of people with Parkinson's disease calls for a coordinated, inclusive, and team approach with effective communication with gatekeepers. These individuals have the authority and influence to support or hinder program implementation. Strategies are initial meetings. Schedule formal presentation to outline the purpose, goals, and evidence-based benefits of the program. Next is data-driven communication. Share statistics or case study demonstrating improved quality of life for individuals with Parkinson's disease when daily activities are managed effectively. Also, regular updates by using emails, newsletters, or meetings to keep administrators informed of progress, challenges, and success. Additionally, engagement, invite feedback on operational aspects as in scheduling activities or allocating resources. Communication strategies for stakeholders, residents, and families. First is through informative sessions. Conduct meeting with host families and residents to explain the program benefits, like improving mobility, reducing falls, and enhancing well-being using simple language and visual clarity. Second, survey and feedback. Conduct surveys to identify needs and concerns related to daily activities and care, and act on feedback to show responsiveness. Third is educational materials. Provide brochures or videos on Parkinson's and the program support for independence, and share resources about community services. Fourth, open communication channels. Establish a contact point for families to address questions and concerns. Update them regularly on the program progress. It's very important to recognize that some people may not be able to share their thoughts in this situation. Residents who are in the latter stage of Parkinson's disease may struggle to communicate, and caregivers may be too overwhelmed to express their concern. We need to find a way to listen to them and include their views. To truly connect with these underrepresented voices, we can collaborate with family representatives and the dedicated staff who work closely with residents. Their first-hand experiences and insight can provide invaluable guidance for our assessment process, ensuring we capture a fuller and richer perspective. Now, let's take a moment to explore the strengths and limitations of our approach. A major strength is employing both qualitative and quantitative methods, which allows us to gather a comprehensive understanding of residents' needs. Residents with advanced Parkinson's disease face challenges in participating in surveys and interviews as their condition may hinder effective communication. Also, time constraint can limit the number of insights we can gather. For advocacy and ethical consideration, in terms of advocacy, we will work towards obtaining improved resources and training for staff to enhance care, ensure that residents' voices are heard, and that their needs are met with appropriate interventions. For ethical consideration, we must ensure informed consent from residents of their legal representatives, maintain confidentiality and ensure privacy throughout the assessment process, and respect residents' autonomy while providing necessary support. Finally, what have we learned as a group? First, we gain insight into the unique challenges faced by individuals with Parkinson's disease in long-term care setting. Second, we recognize the importance of personalized care tailored to individual needs. Third, emphasize the necessity of accessibility to resources and support services for both patients and caregivers. Fourth, acknowledge the value of collaboration with various stakeholders to address the complex needs of this vulnerable group. And lastly, understood the critical role of community nurses in advocating for improved quality of life for residents with Parkinson's disease.